All right, thank you. And thank you for the invitation and look forward to this conversation. And so my name is Dr. Cynthia Williams. I'm assistant professor in the School of Global Health Management and Informatics. And so my industry experience, actually I'm a physical therapist by trade. I have a degree from the University of Florida in exercise physiology. I later moved on to Florida A&M where I got my degree in physical therapy and then came to UCF for a master's in health administration, and then later a PhD in health services research. And so in that time, I opened up my own home care agency and actually did some work as a data analyst for an insurance company. And so my industry experience has really informed my research from a patient perspective and looking at healthcare as an area that is very sensitive. And as we consider technology, the importance of considering patient and clinical outcomes. Currently, I teach in a health administration program where I really focus on health information technology and systems and scientific inquiry, which is a research methods course for master students. And at the executive level, I also teach health information systems. I hold a variety of collaborative positions from UF Health, Mayo Clinic with USF. And then I'm a part of Florida Telehealth Work Group and the American Telemedicine Association. And then, of course, the Academic Health Sciences Center, where we seek to engage the community in a lot of our research. And of course, I sit on the chair of the American Public Health Association, American Journal of Public Health. So an overview of my research, primarily my topics revolve around health information technology and patient outcomes, where we're looking at access to various technologies, whether it be text messaging, remote monitoring, different wearable types of technology as an aid to clinical decision making. One of the things I do find as I work with providers, they're looking at, oh, this will provide a solution, where I'm very quick to emphasize that we use technology to give us information so that providers still own the decision. And that is really important as we discuss various technologies, and particularly as we move to artificial intelligence. Many times I'll also have people from the industry, from the administrative side. We do look at utilization, cost effectiveness, and hospital performance as we use technology, so that administrators are able to, from a very real perspective, see the return on their investment, that can really go beyond patient outcomes and look at the cost and how to overcome some of those, just the cost of technologies. And in particular, last several years, and even as my time as a clinician, how does technology influence or not influence people who experience vulnerabilities, whether they are low-income minority populations who don't have access to technologies, and this technology becomes almost a divider in the healthcare? How can we foster greater engagement? And then particularly looking at older adults and non-Hispanic Black patients, where we do see that overall engagement is lacking. And so really honing the attention on not only the technology itself, but to increase the utilization of technology, where we see in the healthcare system that the people who many times have the greatest need for technology to facilitate the delivery of care, oftentimes not using the technology, which can be problematic not only from a patient outcomes, but from a cost perspective. One of the things that we realize is that most of the costs of our healthcare system are perhaps borne by the individuals who need to access technologies for a variety of reasons and are not. Just I want to highlight a couple of the projects that I am working on with some of my collaborators. But when it comes to many of my collaborators are both business clinicians as myself, are physicians and a computer engineer, software developers. And so this is one technology where a colleague of mine at the University of North Florida developed a robot, and we are looking at issues of the robot-human interaction and looking at trust, right? So particularly in rehab sciences, where we see that technology is being used in a variety of disciplines in healthcare, but particularly in rehab sciences, not so much. We're still very manual in how we do our assessments, how we do our evaluations. And so there has been really a fertile ground in terms of developing the technology, but also taking the technology and putting it in the clinic. Many times what we're seeing is that either the clinicians or the patients don't trust the technology, or it adds to their workload. And so in this particular instance, a collaborator developed a robot, and we have partnered with Brooks Rehabilitation. Their main rehab hospital is in Jacksonville, and we have garnered and allowed patients to use and garner their perspectives about trust in the robot. And this is particularly important because you have patients who need care, and needing and using technology when you're already in pain presents a different parameter than perhaps a younger patient who has high digital literacy. And so this is a study that we are able to pilot. Currently, we are expanding this study to the Mayo Clinic population, really to get increase our sample size and to better understand how various patient populations who need physical therapy will engage with a robot as an adjunct to their rehabilitation services. So a very different scenario, not having the robot replace the therapist in terms of the ongoing care, but moments that will allow the clinician to be productive, and then transferring the appropriate parts of that care to, let's say, a robot to assist with exercises. And then the second project was really interesting. This project has kind of two perspectives, that I'm just presenting the clinical perspectives right now. This was a wearable technology that enabled us to collaborate with a computer engineer, actually out of Canada. He actually contacted myself and my colleague, who at the time was the rehab director of Brooks Rehab. And so this was a wearable system that allowed us to track range of motion, particularly of the knee. And this is really important because this is a very manual system currently. As a physical therapist, you're using the measuring tool, you're manually placing it on there. And it doesn't really allow for continuous assessment while the patient is exercising. And so, but this unit was placed around the patient's knees at the assessment, and we used it throughout care. And so in this perspective, we're on garnering feedback about the clinician's perspective about the system. If clinicians, as the end user, do not have buy-in, I mean, quite honestly, they're just not going to use it in patient care. And so this provided us opportunities to not only understand before they use the system, what are they anticipating about the system? As they use the system, what are some things that perhaps they saw areas of improvement? And it allowed us to be more iterative with the computer engineers. And what we, our preliminary analysis and what we do see is, these therapists were younger, they have, their doctorate and PT, but they still have a high expectations about what that interface should look like. And as we know from a patient perspective, that visual feedback is so important. And so as we continue, we've concluded the study. What we are doing now is analyzing the data, looking at end user acceptance and design. And while this, the preliminary analysis, perhaps the expectations were not met. And so we had an incredible opportunity to meet with engineers to provide some feedback and some areas to improve the feasibility and the end user acceptance of this particular wearable. And one of the things that we did see that was challenging, and looking at various wearables that really have come out, is we see that many of them do not have the need to collaborate. And I will say, as a feature, this was really difficult, not only for the clinicians, but for the patient as well. Because the idea behind a wearable is something that it would be simple enough, but yet sophisticated in terms of visual feedback for the patient to use. I have an opportunity to meet with several engineers, not only in Canada, but UCLA. A lot of actually postdocs who are developing systems will contact me, and we'll talk about what are some requirements of a system. And so that interdisciplinary perspective is really important, because eventually this is something we do want the patient to use it in a home environment, something that can be used because it's a small and supportable device. And so I think this is one area that really provides opportunities for interdisciplinary collaborations. From the engineering perspective, being able to develop these systems, but at the same time, maybe an iterative process where you're getting that feedback from clinicians and patients to improve the design, something that's perhaps a little more marketable, and that clinicians will use not only in the facility, but can something that's marketable to patients so that they'll continue that rehab. So like I said, we're continuing to analyze the results on the clinicians, and actually our team met yesterday. We're also gathering the data to analyze that from the patient perspectives, looking at how these types of systems can not only reduce the cost of care by increasing engagement, but also looking at functional outcomes. And really, from a technology perspective, we're looking for something that's not necessarily superior to the manual, but we are looking really for non-inferiority in what we're able to do. And so my research priorities is looking at how the next step is, how do wearables integrate with telehealth? As we see a lot more rehab being via telehealth, being able to incorporate robotics and wearables in that as well. My current collaborator at UNF has developed a different type of not a wearable, but a robot that can be integrated with telehealth. And so we're looking to actually start here shortly to pilot that with hand therapists via telehealth. And then, as I mentioned earlier, applying health information technology to health inequities, looking to overcome some of the barriers in the healthcare system. One of the things that I'm currently studying is hospital at home. So this takes the Internet of Things, if you will, and applies it to the patient's home, so that the same level of service that a patient would get in the hospital, they're receiving that at home. And then, of course, a huge part of that is broadband internet access. And then in terms of technology and future research, we think of technology as being very innovative and forward-moving. And as we develop and looking to apply that, in my aspect, that future starts now. So looking at 3D health, currently a department at UCF is developing that. And how do we make it more user-friendly for all populations? And then, of course, looking at artificial intelligence, currently working with Crest on a project with Advent Health and Mayo Clinic to look at how different diagnoses, and then looking at their outcomes. How can we use that to predict or develop treatment plans that not only are feasible, but that considers the diagnosis, the intensity of diagnosis, and patient characteristics, not only to optimize outcomes, but there's a particular interest in the National Institute of Health about equity in chronic disease management and clinical decision making. And so these are just some areas that I'm starting to embark in terms of research, and very much of interest to funders like the National Institute of Health, the National Institute of Minority Health Disparities, and of course, the National Science Foundation. So really excited to start these projects. And then of course, what I do on the healthcare aspect, I have collaborators from several different institutions and across disciplines. And so, you know, I would be remiss not to acknowledge them and the leadership and the mentors in this area, particularly as it's truly in the area of technology and artificial intelligence, really is a collaborative venture. So thank you. And I would be happy to engage any questions.